After 33 years in law enforcement, former Maryland State Police officer Neill has taken a strong and unexpected position on drug enforcement. Mr. Franklin is the executive director of Law Enforcement Against Prohibition. We're happy to have you in the studio.
Thanks for having me, Angela.
Well, let's make it clear up front to everyone. We're saying that all drugs should be legalized. Is that your position?
Absolutely.
Okay, now that is going to be shocking to all of our viewers, so we know you need time to let that soak in.
Yeah, let that simmer a little bit.
Let that simmer for a bit. All right, tell me from a law enforcement officer's perspective why you have decided to stake a claim on this issue like this.
I think it's pretty simple, but I didn't realize that at first when you go back a few decades when I was in the middle of it all. Think about it. Our drug policy should be reducing crime, disease, death, and addiction. They don't. They actually make things worse. Our drug policies actually, well, they're counterproductive to public safety. Okay, the very thing that we sign on for as cops, to improve public safety within our communities, right? We want less violent crime. But these drug policies give so much power, control, and influence to the cartels and organized crime and our local gangs and crews. You know, that's how they make most of their money. They recruit our children out of schools to work the street corners. And how do they manage that business? Guns, violence, coercion, kidnappings, the list is long. So these drug policies create a very lucrative underground marketplace for selling drugs. That's where the violence stems from. That's where most of our community neighborhood violence comes from.
And also, that whole setup prevents police officers and people living in the community from working together and having a good relationship, which is very important.
Absolutely. These drug policies that cause us, the police, to put more people in prison than ever before makes us enemies of the community. We virtually go in and occupy a neighborhood or a community. Here's another thing that most people don't realize. The numbers of people we're sending to prison, mostly for nonviolent drug offenses, what happens when they go into prison? Right. When I talk to a corrections official, they tell me that that person has 24 hours to decide whether they're going to be predator or prey. Yeah. And eventually that person is going to return to you. And most likely they're going to return to your neighborhood as a member of a gang. Mm-hmm. They may have to put in work. They may have to pay for the protection that they had while they were inside. Mm-hmm. But I can guarantee you, more than likely, they're going to return to you a violent person, or at least one who knows a lot about violence now that they've been in that environment.
Okay, so tell me, how do you envision our society being set up now if all drugs are legal? Because alcohol is nothing but one big fat drug to me. You know, I mean, people do bad things when they're on alcohol, just as you can say is true of heroin. Not that I know anything about heroin. I do know I take a drink every now and then. But how do you see the government setting up the system? Because I'm assuming the government would have some control or some role in the new America you're envisioning.
Right. And just so people know, it's not just me as a former police officer, but it's literally thousands of members of our organization, Law Enforcement Against Prohibition, and not just police, judges and criminal prosecutors and corrections officials, even some former DEA agents too. So here's the deal. The current marketplace, as we mentioned, is being run by organized crime and criminals, basically the cartels. We know this industry is going to exist. It has existed in the past, it exists today. This multi-billion-dollar, $322 billion global industry will exist tomorrow. The question is, who do you want to manage it? Criminals, the cartels, local gangs, or do we want the government and responsible citizens to manage it through forms of regulation and control? Because today there is no regulation and control. Drug dealers don't card children, they don't ask us how old you are, they hire children into the business. There's tainted drugs, adulterated drugs, dangerous drugs. We have an untold number of heroin deaths today, overdoses today from fentanyl-laced heroin and who knows what else. Regulation and control would end that.
So then how would the government actually set up the regulation and the control?
Well, let's start with one that most people can get their minds around. Marijuana.
Okay.
Okay. Colorado has already started down that road, along with Washington State soon to follow. All right. Think about the pictures and the videos you've seen of people buying marijuana from these new legal stores. Any kids standing in line? No. Any kids behind the counter selling it? No.
But you have to admit that even if things are made legal, that there's always going to be a black market for people who can't get it for whatever reason because of the controls that are put on it or the limitations. So you're still going to have a need, a supply and demand, because kids are now going to want it, and those drug dealers are not going to go away. I don't see them going away in this scenario.
Well, what about Al Capone and his cronies? Are they still hanging around?
No, we got them, you know, because of tax reasons. But also
Well,
the country decided to get rid of Prohibition.
All right, so let me put it to you this way.
Okay.
You may be able to answer this question, but I sure can't. I don't know where to go find bootleg booze today. I don't know where to find it, and the average person cannot find it. Is there still a black market for it? Yes, it is. There's an underground market for bootleg whiskey. I can't tell you where to go get it. Is there an underground market for untaxed cigarettes? Yes, there is. But is there any violence associated with it? Do we have, you know, neighborhoods in siege because we have drug dealers on the corners? You know, are the cartels heavily involved in the tobacco industry to where they're taking over towns in some countries?
No. So you definitely see that this will either cut down on the black market or completely eliminate it.
It will take it to a level where there's no more violence involved with it. That's the key. And when you get to that point, we have safer communities. When we get to that point, we're no longer throwing so many people in prison. You know, the vast number of people, let's see, before the drug war in the early 1970s, we had about 415,000 people in prison for all drug-related crimes. By 2005, 1.9 million people in prison in this country. In this country, we are 5% of the world's population, but yet we have 25% of the world's prisoners. This is the land of the free.
Yeah.
At least I thought it was.
I understand that. Economically, how can we benefit? How will the United States benefit economically if all drugs are now legal?
Well, in a number of different ways. First of all, we're going to experience a $50 billion savings from cops, courtrooms, and prisons, because that's what we're currently spending across the nation every year. In addition to those cost savings, we're going to have taxes like we do with marijuana being sold now in Colorado. And I think it's like $14 million in gross sales every month occurring in that state. And they only have a few stores open right now. So the tax windfalls, and I think many states are starting to see what's happening in Colorado. Colorado is going to be a state that's no longer in financial ruins. And there are going to be some other states to follow. But the biggest financial, I guess, windfall is not going to be in what we're bringing in, it's going to be in what we're saving. The indirect cost, we never think about. Those people who are in prison, even when they come out because they can't get a job, there's still a burden on the state. When we stop sending people to prison and they can work and they can pay taxes and they can contribute to society, that's an indirect cost we don't really calculate right
So then
now.
do you envision this new system being set up similar to what Colorado has done, where you have private people who are growing marijuana and selling them the product in little stores, and you know they now can deal with banking transactions?
Absolutely.
So we would have a store where somebody sells heroin, LSD.
It's possible. I mean, there are some people who advocate for that. Personally, I don't. And this isn't, my position isn't that of the organization that I work for. But I like what they're doing in Switzerland. And I like what they're doing in Portugal.
Tell us what that is.
In Switzerland, they have a safe injection site, a clinic, to where those who are addicted to heroin go. And if they need 2 or 3 doses a day, they go 2 or 3 times a day under medical supervision with a clean syringe. They administer their dose of a pharmaceutical grade heroin where they know what the potency is.
But that's somebody who's already addicted. What if I'm not addicted, but I'm like, well, drugs are free, I'm going to go try heroin
Well,
today?
maybe then there's a pharmaceutical model for you. Okay. You know, maybe there's something that where you just don't go into like a convenience store and buy it, but there's maybe a couple barriers, nothing strong enough to put you into a black market sales area or distribution area, but just something to make sure this is what you really want to do. But here's my question. For you and all the listeners out there, if heroin is legal tomorrow, for all of you who do not use, would you use it?
I don't have any desire to.
And you're no different than the average person who currently doesn't use. They're not going to use. Anyone who wants to use heroin, they're using it because it's so easy to get.
It's easy to get now on the black market.
Absolutely. School-age children report every year that it's easier to buy illicit drugs than it is to buy alcohol. And there's a reason for that, because when you want to buy alcohol, you have to show ID, that you're 21 years of age before you can purchase it.
So those types of controls, if they were in place, then you feel like we could have a similar scenario as we do with respect to purchasing alcohol and being of the right age and et cetera.
Absolutely, absolutely. You know, I guess the best way to put this is, we know that the current drug war has failed.
I think everyone would agree with that.
I haven't met anyone that says we're having all this wonderful success or any success at all. Things are actually going in the opposite direction. So if we know we're in this dangerous place, why are we still here? Why haven't we had the reasonable conversations to figure out what the policy would be going forward? What would those regulations look like? We're not even having the serious conversations in our city centers, you know, in Capitol Hill.
Well, Neill Franklin, I think people would call this thinking out of the box. And while people claim they want to think out of the box, you're confronting people and saying, here's an idea that's really way out of the box. So we'll see if people are willing to come over to your side. But thank you so much for talking to us about this.
Thanks for having me.
It's very, I think, revolutionary.
Well, it is, I believe, our most important issue of today.
I would agree. Thank you so much. Thanks. Neill Franklin, Executive Director of Law Enforcement Against Prohibition.
Thank you.